Good afternoon. In today's video, I want to update everyone on the resolution we passed last night, share more data, and discuss reopening, as well as an update on our concert series. Last night, we passed a resolution with a board vote of 5-1. Trustee Fenton was absent, and Trustee Calandrello was the sole no vote. The first part of the resolution went as follows. The Village President and Board of Trustees of the Village hereby call for the Illinois General Assembly to reconvene to address the health, safety, and welfare of Illinois residents in light of COVID-19 by exercising their valid authority to legislate in those areas. While the Governor is doing his best to address the pandemic, our legal advice informs us that he is being extended potentially beyond his legal authority to try to combat the pandemic without the legislature's assistance. The General Assembly is the appropriate body to deliberate and resolve these issues, and they must get back to work. It is time for them to reconvene and do their jobs. Second, we stated, the Village President and Board of Trustees of the Village call for the executive branch to make publicly available the data, models, and assumptions used for decision-making by the state of Illinois as an aid to local authorities as they set local plans for reopening. A specific example of transparency and disclosure is the IHME website. The Governor has had to make a lot of difficult decisions during these challenging times with limited information. I think this is well understood, which is why he has been given a lot of latitude, and appropriately so. For example, we are 58 days into his 30-day emergency declaration and 46 days into his stay-at-home order. On April 23rd, the Governor introduced new analytics and modelers that he is using to inform his decisions. These experts indicated that they were using only state of Illinois information and that the stay-at-home order had saved 30,000 lives. Also, according to the Governor's new executive order, these models indicate that without the stay-at-home order, the state would have needed over 100,000 hospital beds, over 25,000 ICU beds, and over 20,000 ventilators. The comments of April 23rd, along with those made in the Governor's executive order, can be used to reverse engineer the case curve implied by these models. This is what I will walk you through now. March data indicated 20% of cases needed hospitalization, 5% needed ICUs, and 4% needed ventilators. Dividing the needs by the percent of cases results in the number of cases. In all of these examples, this implies a minimum of 500,000 cases. Alternatively, we could use the rates of hospitalization, ICU usage, and ventilators that were current on April 30th. Using those numbers, the model Governor Pritzker is using appears to imply between 1.1 and 1.4 million cases. On March 17th, the state had 160 cases. Infectious disease specialists focus on how many days it takes to double. The cases implied by the models from the previous slide, 500,000 to 1.4 million, indicate that the doubling rate is every 3.4 to 3.9 days from March 17th to May 1st. These doubling rates allow the curve that you see here to be developed. In other words, according to the Governor's models, without the stay-at-home order, we would have between 2 million to 5.6 million cases by the end of this week. This is up to half of the state. Does this make sense, or does it seem to be overly pessimistic? At the April 23rd press conference, the experts indicated that their models showed that the Governor's actions had saved 30,000 lives. Combining these saved lives with our actual deaths on April 23rd allows us to compare the death rates that these models projected. As stated previously, the range of cases from the models is somewhere between 500,000 and 1.4 million cases. This means that on April 23rd, the experts were saying that in the absence of a stay-at-home order, the morbidity rate would be between 11.2% at 1.4 million cases and 26.5% at 500,000 cases. Compare this to the known hospitalization rates of March, 20%, and of April 30th, 8.4%. Does a death rate higher than the known hospitalization rate, or multiples of the ICU rates, make sense? To me, it makes no sense and does not seem plausible. On April 30th, the Governor's executive order states that deaths would be 10 to 20 times higher if no stay-at-home order was given. This would result in 23,000 to 47,000 deaths based on the total deaths on April 30th. This implies a morbidity rate between 1.7 and 9.4%, depending on the number of cases. Bear in mind that just 1 week earlier, these same models generated a morbidity rate of 11.2 to 26.5%. How does this happen? Does this make any sense? It does not, and it is inconsistent. Using the statements made by experts on April 23rd, as well as the statements in the executive order, the case curve implied by the models can be determined as I have shown. While these case curves certainly support the governor's current position, they appear to be overly pessimistic and, more importantly, implausible. Additionally, at the April 23rd press conference, we were told that these models use only Illinois data. By April 23rd, there was significant information gathered from other countries and states that could be helpful in building better models and help the state of Illinois make better decisions. Moreover, some other states and countries did not issue similar stay-at-home orders and did not see case doubling rates anywhere near the doubling rates these models predict. Ultimately, since the initial restrictions on March 17th, there is a lot more information and data available to help inform our decision-making. A model can be very useful in the decision-making process, if it is good. Additionally, if the decision-making is data-driven and fact-based, as we have been told, then it only makes sense to release the data that supports your decisions. In the interest of full transparency, Governor Pritzker should make the models, data, and information he is using available to the public. This information, including that from other states and countries, can be used to keep people safe while reducing or eliminating the negative impacts on the economy, which was our third point, where the village president and board of trustees of the village call for the General Assembly and the governor to articulate a reopening plan for the economy as quickly as possible with reasonable guidelines designed to promote the health and welfare of Illinois residents, including the residents of the village. Now I'd like to move on to showing you some of the latest data that we are looking at. Hospitalization in suburban Cook County has flattened, while statewide COVID patients in the ICU and using ventilator is also flat. These are good signs that we are turning the corner. While we have seen that cases in Illinois have been trending upward, this is largely due to the fact that we have tripled the amount of daily testing in the last couple of weeks. You can see this by looking at the percent of tests that are positive, which is down significantly. Additionally, in suburban Cook County, it appears that the number of daily cases is trending down over the last few days. This is also very good news. The data that gives me the most optimism is the downward trend in deaths for suburban Cook County. This trend indicates a few things. Particularly when you remember that this is a lagging indicator. It suggests that the worst is behind us and that the treatment regimens are working more effectively. This is not only positive for the moment, but it is great news if we see an increase in cases as things open up. As we prepare for opening, please remember that every phase of our plan suggests that those over 60 and those with compromised immune systems should stay at home. Additionally, nursing homes and other senior living facilities should not have visitors in the first two phases. This is because the data clearly indicates that our elderly population is particularly vulnerable to COVID-19, as evidenced by hospital rates and death rates. Prior to reopening, we will want to make sure that there is a significant ICU and ventilator capacity. The good news is that we have plenty of capacity in the southwest suburbs. The other piece of good news in Orland Park is our number of daily cases appears to be trending downward. All of these numbers suggest that the ability to reopen is coming. We are currently working through some questions. How do we reopen? When do we reopen? We have not heard back from the governor on our suggested reopening plan for Orland Park, but we are hopeful that he will embrace our plans and other plans that have been created in the absence of any guidance from the state. Our reopening plan aligns with the White House plan and was the result of significant research and the input of many businesses and experts. We have also sent the governor an updated version as of today. I believe that we can keep people safe and begin to reopen. It is not an either-or scenario. We have a lot of smart people and over 2 months of information from all over the world to help inform our decisions. We can develop smart and measured approaches to reopening that keeps people safe at the same time. It will mean some inconveniences. For example, masks, social distancing, or smaller groups. Those inconveniences will be a small price to pay for otherwise returning to normal. We are hopeful that we can return to normal. In order to return to some sense of normalcy, we need a plan for it. That is why the village created a plan. Here are some of the great things that are currently going on in the village. The VFW is doing a virtual Poppy Day, which is their biggest fundraiser that is done every Memorial Day. The Village has continued to advertise for our local businesses, and the Orland Park Chamber has a new event to promote curbside pickup at our retail shops. The Village of Orland Park's Masks for Medical program has been a resounding success. Many medical businesses were able to reopen because we found masks for them. We went through our first order, but more are coming this week. Our staff did a great job implementing this program. Last, but certainly not least, is our concert series. Tickets went on sale on Friday. They are available by phone until May 22nd for residents only at a discount for the 3-concert package. Tickets are limited, and we are hoping that we sell out to residents only in these 3 weeks. It's $65 for all 3 concerts. I want to remind you that the concerts will only go on if factual evidence deems them to be safe, and there is no risk to purchasing because we will provide refunds if they are canceled due to the health crisis. I am optimistic that we can get back to normal. I hope you are too. As a society, we can walk and chew gum at the same time. This current situation is a problem, but problems are meant to be solved. Together, we can find solutions so that we can have normal lives again. Let's work together to make this happen. Thank you.